the shadow of addiction, a crisis of the brain. Addiction is not just a personal failing or a lack of willpower, it is a profound and complex brain disease that casts a long shadow over the lives of those it touches. Addiction is a complex brain disease. It involves intricate changes in the brain structure and function, making it a formidable challenge to overcome. It affects millions of people around the world, from bustling cities to quiet rural areas. No community is immune to its reach. This disease does not discriminate. It touches people from all walks of life, regardless of their background, ethnicity, or social status. It impacts people of all ages, backgrounds, and walks of life. From teenagers to the elderly, from the wealthy to the impoverished, addiction knows no boundaries. At its core, addiction hijacks the brain's reward system. This system, which is designed to help us experience pleasure and motivation, becomes a battleground. This system normally helps us experience pleasure and motivation. It rewards us for activities that are essential for survival, like eating and socializing. Addiction throws this delicate balance off. The brain's natural reward pathways are overwhelmed, leading to a cycle of dependency and compulsion. It creates a powerful drive to seek out and use substances or engage in addictive behaviors. This drive can become all-consuming, overshadowing all other aspects of life. This compulsive drive can have devastating consequences. It can tear families apart, destroy careers, and lead to a downward spiral of despair. It can lead to serious health problems, strained relationships, and financial ruin. The toll on physical and mental health can be severe, often requiring intensive medical intervention. Addiction is a chronic, relapsing disease. This means that even after periods of recovery, the risk of relapse remains high. This means that individuals may struggle with it for years or even a lifetime. However, there is hope. With the right support and treatment, recovery is possible. With a deeper understanding of the brain mechanisms involved, we can develop more effective treatments. Advances in neuroscience are paving the way for new therapies and interventions. We can also reduce the stigma surrounding addiction and support those in recovery. By changing the narrative, we can foster a more compassionate and supportive environment. Understanding addiction as a brain disease is crucial. It shifts the focus from blame to treatment, from judgment to support. It helps us move away from blame and judgment. Instead, we can offer empathy and understanding to those who are struggling. Instead, we can approach addiction with compassion and a focus on treatment. This approach can make a significant difference in the lives of those affected. Just like any other chronic illness, addiction requires ongoing care and support. Continuous treatment and a strong support system are essential for long-term recovery. We must continue to invest in research and education to combat this pervasive problem. By expanding our knowledge and resources, we can make strides in preventing and treating addiction, ultimately improving countless lives. The brain's reward system is a complex network of neurons. It is responsible for feelings of pleasure, motivation, and reinforcement. When we engage in activities that are essential for survival, like eating or social interaction, this system is activated. We experience pleasure, which reinforces these behaviors. This ensures we repeat them. Key neurochemicals like dopamine play a crucial role in this system. Dopamine is often referred to as the feel-good neurotransmitter. It is released in response to rewarding experiences. This creates a sense of pleasure and motivates us to seek out those experiences again. In a normally functioning brain, the reward system is carefully regulated. It helps us maintain balance and make healthy choices. However, addictive substances and behaviors disrupt this delicate balance. They flood the brain with dopamine, hijacking the reward system. Repeated exposure to addictive substances or behaviors leads to significant changes in the brain. These changes are not just temporary. They can have long-lasting effects that alter the way the brain functions and processes information. These changes occur both structurally and functionally. Structurally, the brain's physical makeup is altered, while functionally, the way the brain communicates and processes information is affected. Over time, the brain adapts to the presence of the addictive substance or behavior. This adaptation can lead to significant shifts in how the brain operates on a day-to-day basis. This leads to a phenomenon known as tolerance. Tolerance means that the brain becomes less responsive to the substance, requiring higher doses to achieve the same effect. This means that individuals need more and more of the substance or behavior to achieve the desired effect. This escalating cycle can be incredibly difficult to break and often leads to increased consumption and dependency. One of the key areas affected by addiction is the prefrontal cortex. This part of the brain is crucial for higher-order functions that are essential for daily life. This region of the brain is responsible for decision-making, impulse control, and planning. When addiction takes hold, these critical functions are compromised. Addiction impairs the prefrontal cortex's ability to function properly. This impairment can lead to poor decision-making and a lack of impulse control, making it harder for individuals to resist the addictive substance or behavior. This contributes to the loss of control that is characteristic of addiction. Individuals may find themselves unable to stop using the substance or engaging in the behavior even when they want to. Furthermore, addiction weakens the brain's ability to experience pleasure from natural rewards. Activities that once brought joy and satisfaction may no longer have the same effect. This is because the brain becomes so accustomed to the surge of dopamine from the addictive substance or behavior. Dopamine is a neurotransmitter that plays a key role in the brain's reward system. As a result, individuals may find that activities they once enjoyed no longer bring them joy. This can lead to a cycle of continued use as they seek the dopamine high that the addictive substance or behavior provides, further entrenching the addiction. Section 4. Nature and Nurture: Unraveling the Roots of Addiction. Addiction is a multifaceted issue that has puzzled scientists and healthcare professionals for decades. Addiction is a complex disorder influenced by a combination of factors. It is not merely a matter of willpower or moral failing. Both genetics and environment play significant roles in its development. Our genetic makeup can predispose us to certain behaviors and vulnerabilities. Research suggests that certain genes may make individuals more susceptible to addiction. These genetic factors can affect how our brains process pleasure and reward. These genes can influence how the brain responds to addictive substances and behaviors. For instance, some people may experience more intense euphoria from drugs or alcohol, making them more likely to seek out these experiences repeatedly. Environmental factors also play a crucial role. The surroundings we grow up in, the experiences we have, and the people we interact with all contribute to our risk of developing addiction. Trauma, stress, and early exposure to substances can increase the risk of addiction. These experiences can alter brain chemistry and make it harder to resist addictive behaviors. For example, individuals who have experienced childhood abuse or neglect may be more likely to develop addiction later in life. The emotional scars from such experiences can lead to a search for coping mechanisms, sometimes in the form of substance use. It's important to note that neither genes nor environment alone determine whether someone will develop addiction. It is the interaction between these elements that shapes our susceptibility. It's the complex interplay between these factors that contributes to vulnerability. Understanding this intricate relationship is key to addressing the root causes of addiction. Understanding this interplay is essential for developing effective prevention and treatment strategies. By recognizing the roles of both nature and nurture, we can create more personalized and effective approaches to combat addiction. Section 5. Paths to Recovery, Treatment and Hope. While addiction is a chronic and relapsing disease, recovery is possible. A variety of effective treatment approaches can help individuals break free from the cycle of addiction. These approaches address both the physical and psychological aspects of addiction. Cognitive behavioral therapy, or CBT, is a widely used and effective therapy for addiction. CBT helps individuals identify and change the thoughts, feelings, and behaviors that contribute to their addiction. It provides them with coping mechanisms to manage cravings and triggers. Medication-assisted treatment, or MAT, is another valuable tool in addiction treatment. MAT involves the use of medications such as methadone or buprenorphine to reduce cravings and withdrawal symptoms. MAT is often used in combination with behavioral therapies for a comprehensive approach to recovery. Section 6. The Ripple Effect: Addiction's Cost to Society. Addiction is not just a personal problem, it's a societal issue with far-reaching consequences. The economic burden of addiction is staggering, costing billions of dollars each year in healthcare costs, lost productivity, and criminal justice expenses. Beyond the financial toll, addiction has a profound impact on families, communities, and relationships. Substance use disorders can lead to domestic violence, child neglect, and strained relationships with loved ones. The stigma surrounding addiction often prevents individuals from seeking help. Addressing the societal impact of addiction requires a multifaceted approach. This includes increasing access to affordable treatment, providing support for families affected by addiction, and reducing the stigma associated with substance use disorders. Section 7. Breaking the chains: knowledge, compassion, and support. Addiction is a complex brain disease with profound individual and societal consequences. However, by understanding the neuroscience behind addiction, we can develop more effective treatments, reduce stigma, and support those in recovery. Continued research is essential to unravel the complexities of addiction and develop new interventions. Education and awareness campaigns can help dispel myths and misconceptions surrounding addiction. Most importantly, we must approach addiction with compassion and understanding. By supporting individuals in recovery and their families, we can create a brighter future free from the grip of addiction. Together, we can break the chains of addiction and foster a society that values health, hope, and recovery.